I have the great pleasure now of being joined by Dr. Umair Shah, who is the Executive Director of Harris County Public Health. Thank you for being here. We talk about your county, third most populous in our nation. What is your biggest concern? Because you had a heck of a time over the last several months.
Well, it's been a tough summer, and first of all, thank you for having me. And you know that this has been 2017 has been highlighted by some fantastic things. For example, our own Houston Astros baseball team just won the World Series, but it's also been really a challenging summer for us with not just Zika and mosquito season and all the other things that we were handling over time, but Hurricane Harvey that hit us in late August, and really it's 2 months later now, but we're still in that midst of recovery.
But yet, you say doing quite well. What is the key to that?
Well, you know, I would say a few things. One is that you're never doing as well as you want to, and you hope you can always do better. But the other is that we've made a tremendous amount of investment over the years from a health infrastructure, but also from a flood control and emergency management and all sorts of infrastructure investments in our county and our city, and really a lot of even our private sector have really taken some of the lessons from Tropical Storm Allison, Hurricane Katrina, Rita, Hurricane Ike, our Memorial Day floods of 2015, Tax Day floods of 2016, and then now Hurricane Harvey, so that really only less than 10% of our health infrastructure was down, which is still significant, but they were our smaller facilities, nursing homes, etc., during Hurricane Harvey. So it really showed that our investment, including in the public health department, really helped us mitigate some of those challenges.
You talk about all of these big storms, and you name them off, that were supposed to be perhaps 500-year storms and
right.
floods, but yet 3 in 3 years. How much is climate change playing a role in that?
You know, I think it's always hard to tell, but we do know that the climate is changing. We do know that there are challenges, especially when it comes to the severity and unpredictability of storms. And so we're on the Gulf Coast. We're only about 45 miles from Galveston and right on the Texas coast. And this has been a busy hurricane season with obviously Hurricane Harvey, but Irma, Maria, Nate, and we've had wildfires in the west. All sorts of different kinds of events. We're about to have winter start. We don't know if it's going to be a wintry winter season that's going to happen. And so for me, climate is really all about what is the impact that it has on the extremes, and how does it challenge us, because we have to really find ways to not just mitigate the prevention, but the impact.
What have you learned in this process that might help other communities who have not done so well after these natural disasters, or others who have not experienced them yet but likely will?
Well, as you know, in my role as the president of NACCHO, the National Association of County City Health Officials, which represents 2,800 health departments across the country, we really see at the end of the day the real challenge that people don't always recognize, that public health is hidden. It's behind the scenes. When we do our job, we're like the offensive line of a football team, right? Nobody knows that you're doing the blocking and all those things, but at the end of the day, we're absolutely critical, just as our other emergency management partners, healthcare sector, etc. And so what we've learned in our community is that you have to invest in the capacity for health departments and public health in general to really grow, to really be strong, to really be available and nimble when an emergency comes. And so what we don't want to have happen is that you have this much capacity you invest in, and so when you have an emergency, you have to really stretch high. We want the capacity to be here, so when you're stretching, it's not as much of a stretch, and you can really get into the response and recovery efforts as quickly as possible.
Dr. Shah, thank you. We wish you continued success as you rebuild Harris County. Thanks.
Thank you. Appreciate it.